Hi, everybody. I am a primary therapist in the red, white, and blue programs here for Sierra Tucson. And it is an honor for us to serve the veterans and first responders in this program. My name is Roberto, and I will be your guide for today's Nourishment webinar brought to you by Sierra Tucson. We will be exploring conflict resolution through anger management, as you can see on the slide there. And I hope you will find the methods and opinions expressed in here as useful as I have. Go and turn off the webcam so I can go forward on the next slide. Okay, this presentation will address the benefits of negative emotions, healthy behaviors for successful relationships, and how emotions can affect biological processes in the human body. Overall, the presentation will address anger management as a learned behavior and how transference and spirituality play a role in conflict resolution for a happier and healthier lifestyle. I put a picture on there by Julia Ferwerda, Evil and Good, Two Sides of One Tree, just to get an idea how we have different balance systems for our emotions and our behaviors and the purposes that they serve. On this slide, reviewing some interesting facts that may help us appreciate modern standard approach to mental health care. A peer-reviewed article, The History of Mental Illness from Skull Drills to Happy Pills. That's an interesting title. It's published in the Social Science Journal. It depicts priest doctors treating mental illness as far back as 5000 BC. The article also points to Greek physicians around the 3rd to 5th centuries addressing mental illness as a matter of pathology. Hippocrates himself was quoted as saying, all disease begins in the gut. Much later, in around 1925, American surgeon William Sadler is being credited for recognizing what is called here, you see the nerve toxic ad here, for Americantitis. So Sadler's quote says, Americantitis is a cause of disease responsible for high blood pressure, hardening of the arteries, heart attack, nervous exhaustion, and even insanity. Well, today we recognize these symptoms of anxiety and avoidant behaviors. Insanity, of course, is no longer a clinical diagnosis, and shock therapy has been replaced by gentler methods of ECT and TMS that is used in treating severe depression deemed otherwise unresponsive to treatment. So modern medicine does use APA-approved guides to help us diagnose these days, whereas in the past you can see that there were other methods that they were trying in the mental health field that were probably a little bit rough there. So we now have evidence-based practices that we use to treat symptoms, which allows us to reduce the guesswork. And the clinical teams today consist of medical doctors, psychiatrists, and psychotherapists, who often encourage patients to develop additional support systems, including spiritual supports, to help treat the whole person, mind, body, and spirit. So here are some clinical definitions of mental health behavioral disorders according to DSM and ICD. So the DSM, I have a quote here, defines it as a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior that reflects a dysfunction in the psychological, biological, or development processes underlying mental functioning. So that is the quote from the DSM-5, and then the ICD-10 simplifies the definition. It refers to it as a set of symptoms or behaviors, and that is a direct quote. It's not a typo there on behaviors. That interferes with personal functions. And then I have some information from Dr. Richard Pfeiffer, president of National Anger Management Association. He authored the Anger Management Workbook and Curriculum, and he credits the State Trait Anger Expression Index 2 with the definition that we have here on anger. As you can see, there's the definition, the third one. The State Trait is an assessment scale which evaluates the intensity of a person's anger as an emotional state at a particular time. Dr. Pfeiffer teaches anger is essentially about not getting your needs met. So that's a definitions that we're working today in clinical teams to be able to help patients who are suffering with anger management, and we use those diagnoses for mental health or behavioral disorders. So here's a slide that depicts two people kind of in an argument. I mean, their facial expressions seem to be wanting to get resolved, but also typical of what some people may go through. So for some people, anger is the feeling that they most identify with, often gaining the impression of having been quote unquote born this way, right? I've heard some patients tell me that. But if that were true, then the idea would also hold true for any other emotion we closely align with. Negative emotions can help us re-energize. For example, when we spend time being sad, it allows for ideas to generate on what it means to be happy. Recognizing the negative effects anger has on the mind and body leads to question its purpose and to consider possible benefits of anger and other negative emotions. According to an article on WebMD, quote, crying can cause your body to produce hormones that make you feel better, unquote. So the body will try and regulate itself at times of distress, and controlling your thought process helps the mind regulate. During an episode of anger, we often become vulnerable because we tend to express differences of opinion, and that can be uncomfortable. Yet it is through vulnerability that we expand on levels of compassion by listening to the opposing opinion. If you've heard of Brené Brown, you know all about the power of vulnerability. Practice actively listening skills is my suggestion, and your relationships will thank you for it. Here I have some gears depicting problems on medical problems and how they affect the emotional concealment and also affecting the burnout. And also the idea here is to consider that concealing emotions. In one particular article by Seek Yoon, he writes about how concealing emotions at work can lead to burnout and, of course, medical problems. So in an article for the Brain and Research Foundation, The Biology of Emotions by Dr. Kill, she describes adverse effects of negative emotions on the brain. Kill promotes the importance of addressing depressive symptoms as close to the onset as possible for helping, quote, restore the brain to normal functioning, unquote. Kill indicates the brain is physically altered by prolonged overexposure to negative mental health symptoms. So she suggests that we take a look at some of those symptoms that are taking place and actually begin to address them so that our brain is not being prolonged to those effects, thereby causing any more changes in our physical brain structure. And so she suggests addressing them, getting the brain to go back to normal functioning to help us stay on our path to a healthy, productive lifestyle. There is also a research that was based in North Korea that concluded workers who conceal their emotions at work were more likely to experience illnesses requiring medical attention. And this is the second one here by Yoon, Lee, and al. Concealing emotions at work showed a direct correlation with negative health effects, such as, quote, cardiovascular disease and cancer, and also increases mortality, unquote. So this study points at occupational stress pertaining to emotions that lead to burnout, which the study suggests is becoming more prevalent worldwide. There is a takeaway here for clinicians. It is common practice for us to conceal one's emotions when providing mental health care. The takeaway would be to learn to recognize when you need to express your emotions at work and find an outlet. The suggestion is engage in friendly conversations, practice sharing your feelings in group discussions, and honor confidentiality when others share with you. Most of all, do not allow negative emotions to lead to negative conversations and complaining. Be a part of the solution. Interesting to take a look at that studies, and in the reference portion of this slideshow, you will see this Yoon and Lee et al. Reference there if you'd like to look at that study a little bit further. So here's conflict resolution and looking at ways of people deal with their conflict in certain ways, and then they get help, of course, for the various behavior modification that they'd like to engage in or behavior that they'd like to change. Identifying traits and talents unique to the individual can be helpful for understanding personal needs. Effective communication of these needs can lead to increasing natural supports for obtaining desired outcomes. Because everyone has different personalities, people with similar experiences do not always experience things in the same way. All personalities have a variety of traits. People develop and grow different talents. Intentionally applying the benefits of every available emotion to one's personal needs is a powerful formula to living happier and healthier lives. For example, a person who recognizes fear as a defensive mechanism can effectively develop a plan of defense based on personal limits. American psychologist Elaine Aron described traits of the highly sensitive person in her book here that I have on the slide. She explains how people receive information and how some people are closely aligned with multiple emotions at the same time. The book is referenced here, provides an outline for use of traits for increased emotional intelligence, suggesting the benefit of negative emotions. So which treatment method is best for treating these symptoms or addressing behavioral disorders? Here you see some alphabets with letters because a lot of them are references to, for example, ACT, CBT, DBT, and REBT, which uses ABC for describing CBT. Okay, a little bit much there. So whatever the clinical approach to treatment that you think works the best is the one that will work for you. Getting to the root of the problems means sifting through those beliefs, and sometimes it's a matter of perspective at what the problem means and what the results will provide. Assessing the needs of the individual identity and use of personal strengths will lead to the most effective outcomes. So again, taking a look at which method you're using is great, and whichever one you feel comfortable with and you think it'll work, it's probably the one that will work for you. And you see a lot of similarities in some of them, however, they have different techniques to addressing those issues and behaviors. Speaking of perspective, American writer and motivational speaker Wayne Dyer is quoted here. Dyer wrote many books, including one titled I Can See Clearly Now in 2015. Let's take another look at addressing mental health or behavior problems. If we can identify a set of symptoms causing dysfunction and put together a recovery plan using SMART goals, then it stands to reason that we can identify purpose of emotion for sustaining behaviors and perhaps strengthen those behaviors by utilizing negative emotions to the benefit of increasing success in long-term recovery. Again, take the good with the bad in treating the whole person in support of desired outcomes. As far as spiritual influence here, we take a look at accepting personal limitations and anger management as a learned behavior. Acceptance has the experience of grief. That is because acceptance is the goal in processing grief. A person may feel troubled or distressed upon recognizing the need for change. This is where a spiritual support system can be a source of strength. And for this reason, 12-step recovery encourages belief in a higher power and the open practice of the Serenity Prayer. American Christian psychologist Dr. Henry Cloud writes, and I quoted him there, basically says, change happens when we decide that staying the same is more painful than changing, noting the benefit of consequence as motivation. Spirituality, much like outwardly expressions of anger, is a learned behavior and can be developed as a talent in support of desired outcomes, thereby avoiding undesirable consequences or behaviors. So I have here on this slide, again, you choose, right? It's a choice to accept the anger and act out on the anger. So by blaming others, it's not really going to help us. It's just going to keep that anger growing, and it could develop into rage, which is not the best thing. So accept that we are being responsible for our own behaviors is something that we'd like to teach here, to be able to show patients that they can be in control of their thoughts and have a positive influence on their emotions. So blaming others doesn't help. Don't get stuck in that anger because it won't change. Behaviors for wellness. When we become emotional, we activate a lot of energy. It can be problematic if that energy is not managed correctly. The Journal of Anxiety Disorders proclaims withholding emotions causes adverse psychological and social effects. Open expression of emotions leads to increasing supports and intimacy in close relationships. It is important, however, to recognize persons struggling with excessive social anxiety would best benefit from refraining expression of negative emotions, that is, in their romantic relationships, due to the tendency to ruminate on negative experiences, past and present. Therefore, understanding personality traits becomes vital to identifying given beliefs of negative emotions and the expressions thereof. Generally speaking, withholding emotions is not very good for you, psychologically or socially. Social anxiety does involve fear, and persons with excessive social anxiety may benefit from think before we speak. And there's an acronym for think to be able to consider if it's necessary to even speak, right? It would be to consider, think, is it true? Is it honest? Is it inspiring? Is it necessary? Is it kind? And if you say no to any of those, then you may not want to say what you think you need to say at the moment. So again, figuring out what it means for you and going with developing those relationships and how to express your emotions in a positive manner. Practicing mindfulness can help increase personal awareness, to developing traits for greater intimacy and relationship building. 19th century clergyman Henry Ward Bleacher said, "Speak when you're angry and you'll make the best speech you'll ever regret." So breathe and think before you speak. Here is the slide on power of transference, the hidden power of transference. This slide could very well be a presentation of its own. Maybe I'll focus on that for next one. CBT teaches core beliefs impact the perception of our experiences and develop a therapeutic alliance. In developing a therapeutic alliance, a person might feel schooled or judged or even superior to the therapist. The basis for these ideas is founded on emotional triggers of past experiences, be it a tone of voice, a smell of perfume, or an unassuming facial expression. The body reacts and the brain reconciles the reaction by pulling from its past emotional experiences, leading one to believe present and past experiences are one and the same. Those of you in this of the somatic experiences discipline are already a step ahead here, right? Sigmund Freud theorized transference as the ability to unconsciously redirect feelings and desires from one person to another. Addressing transference in a therapeutic alliance is helpful in identifying the source of transference and also helping ruptures of past relationships. Freud suggested that therapists present as a blank slate, or tabula rasa is what I've got on the slide there, for helping patients gain a window into self-understanding, leading to healthier new relationships. As for the blank slate, the therapist, be aware of countertransference. Be honest, do not take things personally. Use of these talents are especially helpful in treating persons with BPD and other personality disorders. So lighten up. It's time for a brief overview. Having gone through this, you should be able to identify benefits of negative emotions, such as the ability to re-energize, increasing compassion, and maybe even identifying a new meaning on happiness. Of course, negative emotions can have serious biological consequences and negatively impact relationships. Understanding negative consequences of behaviors can help you find successful relationships. Anger management as a learned behavior takes practice, so don't be too strict on discipline. And remember, transference of spirituality can be beneficial to establishing healthier and happier lifestyles. Here's a reference slide, which I had mentioned earlier, that we would have some of the studies here. This one is the picture that I had, and then anger management workbook. That one is the one that I suggest that you look at for dealing with anger management. And of course, the study here by Yoon Lee et al. Concerning the concealing emotions at work and how that can lead to medical concerns. And here's another reference. And that would be what I brought to the table today. And I'd like to know if there's any questions. I'll turn the camera back on. Any questions here? There. Okay, we've got a question here. Thank you for bringing them up, and I'm going to look at the first one here. Can you address anger issues with OCD clients that has impulses for violence towards self and others? Yes. People with OCD tend to ruminate on certain ideas, and it's hard for them to let go of it. And so the impulse to act out becomes different. And so having them understand where that's coming from and what the result is may be beneficial for them to see if they want to continue in that way of behavior and what behaviors they do want to change. That's a great question. I've got another couple of questions here as I scroll down there. What different skills are useful in navigating conflict in various categories of life, family conflict, business settings, and handling conflicts in public with strangers? That's a great one. I like that one. What different skills are useful? Breathing, think before we speak, and recognizing what Eric Bernays suggests in transactional analysis, whether we're behaving as children or adults, that's basically the process for slowing down and breathing and trying to understand your role in those situations, especially when dealing with conflicts with strangers. Are you trying to parent somebody? Because that might not be the best. But that's a wonderful question. Got one here, says, I enjoyed the presentation. Thank you. A few affirmations. You've given me some ideas to help one of my clients with anger management. You're welcome. Can you slowly say the think again? Wonderful, thank you. Think before we speak. Is it true? Am I being honest? Is it inspiring? Is it necessary? And is it kind? So if we say no to any one of those, then we probably shouldn't speak, at least at that time, right? So think before we speak. Great, thank you for asking that question. Let's see, I think we got time for one more question here. What is the best approach for addressing transference? Oh, great question. There is a technique called transference-focused therapy that uses what I said, pointed out there, Sigmund Freud said, using that blank slate for providing, that uses a therapeutic alliance for providing that window into the sense of self. So if you want to look a little bit into using transference as positive for helping people with anger management, it could be a good resource for you. I've actually tried that and being very honest and being addressing those with patients with borderline personality, as mentioned in one of the slides, and it's pretty powerful. It's very effective. It's very helpful, and it brings a whole new light to the concerns that people are expressing. And so there's, again, a lot of thank yous for your time, affirmations. I like it when you said people realize they need to change. They may be more difficult to deal with, then I definitely will remember that. Okay, awesome. So that's true. People don't necessarily like change, even if we recognize that we need to change. So we have to figure out what it is that people want to change, which makes for effective therapy. And it also helps us align therapeutically with the patients.